reflex integration in terms of sensory integration and oromotor dysfunction, and the environmental factors and behavioral factors, I think, is what we have discussed in the last webinar. And today we'll talk about food tolerance, food intolerance, food sensitivities, and food allergies, which is again one of the most major criterion which many of the parents really miss out, or not just parents, many of the practitioners too miss out on this. And last time I didn't really touch this particular topic because it is highly controversial, and the research scientific evidence for whatever we are going to see today is controversial. There is not much of evidence in this. There are certain papers which support it, and there are certain papers which refute this. So today, whatever I'm going to speak, I'm not going to contradict, nor I'm going to support the topic. But what you need to understand is, whatever I'm going to tell you, why certain things, there is a research base for it, but how much of that is helping a child with autism is a debatable topic. So definitely, yes, whatever I'm going to talk today is research based, but how much it is related to children with autism is something which, as I said, is debatable. Now, when we talk about food allergy, food sensitivity, and food intolerance, most of the time, these three words are interchanged. Like, parents use these terms, or practitioners use these terms differently, but what you need to understand is all these three terms does not mean the same. Three of them have got different characteristics, and they describe three food related conditions in children. So let us see each one of it. Let us try to understand what is food allergy. Let us try to understand sensitivity. Let us try to understand intolerance. Then probably it becomes easy for you to moving forward to really get to know your kid. Now, when you talk about allergy, food allergy is nothing but an adverse immune response to a certain particular food protein, right? It's the immune system which is reacting to certain protein which has gone into our body through food. And it happens when the immune system mistakenly identifies a specific protein food as a harmful substance. It identifies a specific protein as a harmful substance and starts defending against it. So this particular food protein, as soon as it enters the so this is classified into two different conditions. One is IgE related mediated food allergy, or non-IgE related or mediated food allergy. So most of the times, many of you or the doctors across would tell you that, get an allergy test done to see how the IgE levels are in the kid. So these IgE mediated levels are always testable, but non-IgE mediated food allergens are not tested, or cannot be detected in the body, unfortunately. And that is the reason why many a times children with food allergies are either misdiagnosed or untreated, and the conditions in them prevail, and where it is presented in terms of behaviors for them. So let us understand what is this IgE mediated food allergies. See, what happens is, as soon as this food protein enters, it triggers immunoglobulin E. That's what IgE is, immunoglobulin E is a chemical. So IgE, this particular food protein will trigger this immunoglobulin E, which releases histamines and different chemicals that causes this increased histamine and chemical, which causes this inflammation and allergic reactions throughout the body, affecting their respiratory system, gastrointestinal tract, their skin, their eyes, ears, and nose and throat. And these IgE reactions can be immediate, or it will take place within 2 hours, or delayed. They say it can be immediate or it can be delayed. If it is immediate, it happens within seconds. If it is delayed, you can see all the signs and symptoms within 2 hours of it. And non-IgE mediated food allergies, these are different. This triggers a different kind of immune system response, and immune system directly responds to a particular food protein, causing the release of certain chemicals again. And primarily the reactions take place in the gastrointestinal tract. They take place in your stomach, in your abdomen, and which causes symptoms like, constipation, nausea, vomiting, bloated stomach, or excessive gas, abdominal pain. So these are non-IgE mediated food allergies and IgE mediated food allergies. So what you need to understand is IgE related food allergies are detected through blood tests, wherein this particular immune system is defending against a particular food protein. But non-IgE mediated food allergies are not detected, but they react differently. The immune system responds differently and it is primarily this particular things takes place in the gastrointestinal, but IgE mediated food allergies can be everywhere, like your respiratory tract, your gastrointestinal, your skin, your ears. It affects throughout. Okay, so that is the primary reason, because these are not detected through blood tests. That is the primary reason, reason why various diets, or all that eliminating diets or the challenging diets have come into existence to see how this non-IgE mediated food allergies can be treated with the different kinds of diets, is why and how these different diets have come into existence. Now, what you need to understand here is studies have shown that when non-IgE mediated food allergies are treated, children have shown a tremendous improvement in their behavioral issues. They have not seen changes in autistic symptoms, but they have seen changes in behavioral issues of a child. And the most common food allergies, where I have come across, or when we have tested many of the kids, 90% of the children were found to be allergic to things like milk, wheat, soy, eggs, peanuts, and tree nuts, like your walnut, your almonds, your cashews, and pecans, and stuff like that. And some children are found to be allergic to fish and shellfish. So that's the reason why usually they say avoid milk, wheat, and soy, and that is the precise thing which goes with gluten and casein free diets, right? So I'll come there to explain you more on those things. So when you talk about allergies, it is about your immune system responding to a particular allergen, and it is triggering to release immunoglobulin E, which releases histamines and chemicals which inflame different parts of your body. And non-IgE mediated food allergies are those where your immune system is responding, but primarily it takes place in the gastrointestinal tract. And the difference between both of them is one can be detected with blood tests and one cannot be detected with blood tests. That's the reason why many of your parents, when you see your allergic tests, they will mention only about IgE mediated food allergies, but not the other ones. So this is all about food allergies, what you need to remember. And let us see about food sensitivity. See, food sensitivity is different from allergy because the reaction does not involve any immune system here. It is a general term used to describe an abnormal reaction to food or food additives. So it is more to do with the food additives than with the food. So that is again the reason why they tell all of us to avoid, foodstuff which contains sulfites, aspartame, MSG, and yellow dye, that number 5, and preservatives like BHT and BHA. They say to avoid all that, right? And the reason that is the precise reason why in your elimination diet they ask you to avoid artificial colors, flavors, preservatives, and sweetness. So that is the food sensitivity. What you need to understand, food sensitivity is something which is not because of the food, but because of the additives present in the food, which are precisely the preservatives, and added flavors, added sweetness, those kind of stuff. So that is about food sensitivity for you. And food intolerance is nothing but something in the food irritates your digestive system when a person has less amount of the digestive enzyme which needs to be produced to break down that particular food into amino acids and other things. So if I have to give you an example, like when you take a carbohydrate and if you are having any missing enzymes, or if you are having low on enzymes, this carbohydrate does not get broken down in small intestine, and it goes undigested into your colon, and it starts fermenting there, and that produces excess gas for child, the bloated tummy, or abdominal cramps, or a chronic constipation. And I hope you are following me, because food intolerance is nothing but your digestive enzymes are not produced to the extent where it helps the food to be broken down into smaller micro and macronutrients. Thereby, it passes through your small intestine undigested and gets into your colon and starts fermenting there. Okay, and what you need to understand here is there are certain common food intolerances for children, but precisely when you talk about lactose, which if enzyme called lactase is less, it does not allow lactose to be broken down. And other two more important food intolerance which I came across in children is, one is lactose, sucrose, and fructose. These are the three major intolerances, food intolerances, which a child will carry. Okay, now let us understand. So I hope you are clear about food allergies, food sensitivities, and food intolerance. So these are the three different terms used for three different things. They are not the same terms. They are three different terms. Okay, now let us see, why does actually child develop this food allergy? Usually what happens, when you take some food, your digestive enzymes are released, and they break down this food into proteins, and this protein is broken down into small single molecules which are called amino acids. And these amino acids pass through the lining of your gastrointestinal tract and enters the bloodstream, and they thereby these nutrients are carried through your bloodstream, and as and when your body is required, they are utilized. So what happens in children with autism, the theory behind this what happens in children with autism is, they have got something called as leaky gut, where there is an increased permeability of this wall. Instead of allowing this single small size molecules, it allows the big molecules to enter the bloodstream. And if these big molecules are not excreted through your if it is not filtered and excreted through urine or through your stools, what happens is it gets bound, and that's the reason where your immune system will start reacting to them, thinking that it is something which is harmful for your body. So that is the reason why autism is always linked with leaky gut syndrome. Why they always say, most of the parents use the term, right? My child has got leaky gut. So leaky gut is nothing but the wall between your intestine and how these nutrients need to enter into the bloodstream. That wall, instead of allowing small and simple molecules, small single-sized molecules, it allows big proteins to enter, which are not broken down, and that's where your immune system immediately will react, trying to defend that. And that's the reason why a child develops food allergies. Okay, that is precisely in other words, what you need to, how I can put it across is the immune system overreacts to it. Okay, as this large protein molecule circulates through the, once this bigger size molecule enters your bloodstream, it will react and release certain things called as cytokines. It releases certain things called as cytokines and other chemicals which trigger inflammation and allergy symptoms in your child, thereby causing a lot of behavioral disturbances in them. So if a child is having food allergy, and especially in children with autism, because of this excessive permeability of these proteins to travel through the bloodstream, and your blood, once these molecules enter your blood, your body starts reacting by releasing cytokines and by releasing different chemicals which will in fact trigger this inflammation process and the allergy symptoms. Okay, if your child suffers with one or more of the following symptoms, whatever I'm going to mention to you now, it means that it is not exactly the problem is there, but it could be because of the food allergies. And when you talk about your ears, it could be otitis media, severe infection in the middle ear. And when you talk about nose, it could be nasal congestion, sneezing and running nose. See, unresolved running nose for a longer duration of time, even child being on different kinds of medication. The reason could be because of there might be a food allergy in your kid. And when it comes to eyes, the teary eyes, or the puffy eyes, or the dark circles under the eyes. And when you talk about skin, eczema is one of the major condition. Eczema, skin itches, and hives, red color cheeks. So these are certain symptoms which are associated with the IgE mediated food allergies. IgE mediated food allergies. And when you talk about the respiratory system, it could be difficulty in breathing, or unresolved cough, or asthma, or continuous chronic wheezing. And when it comes to intestinal things, it's about vomiting, nausea, abdominal pain, constipation, diarrhea, those kind of symptoms. And when it comes to neurological based things, child might be presenting with migraine or headaches, and the behavioral problems like hyperactivity, temper tantrums, irritability, impulsiveness are all related to food allergies. So I hope you understood what are the three different components: the food allergy, food sensitivity, food intolerance, and why food allergies take place in a child, and certain symptoms for IgE mediated food allergies also we have covered. Now let us look into the most important part of it, the elimination and the challenging diets, right? Most of the times, many of the parents have asked me many a times, like not many of the parents, 100 out of the 100 parents whom I have seen till date are either on GFCF diet or different kinds of diet. But when they ask me whether they should really provide it or not, we always tell, as professionals or practitioners, we always tell that there is no evidence to it, but you can try it. And if you really find certain differences, you can continue with that. Or if you don't find differences, you don't have to avoid giving your child certain foods which they deserve to take. So most of the time, there are a lot of misconceptions in terms of how to start, where to start, when to end. These are certain things which I come across, and most of the times it is practiced very wrong because of the amount of knowledge, or because the amount of awareness, or there are certain clear-cut guidelines according to Autism Research Institutes. There are certain clear-cut guidelines on using everything and how to use it, how much you need to do it, because I've seen many parents overdoing it, or many parents not really understanding the impact of it. They'll start, they'll stop, on and off things. So let us really understand this elimination and challenge diets. So this is actually used, this elimination and challenge diets is actually used to rule out the false positive or false negative results which come to you through allergy tests. It is the only method where you can identify non-IgE mediated food allergies in your child, and it involves two steps. Please listen to these things very carefully, because it's very important if you're really putting your child on any specific diet. Number one, eliminate the suspected food for first 2 weeks. That is the first step which is involved. Eliminate the suspected food for 2 weeks. And if your child has been diagnosed with eosinophilic enteritis or eosinophilic gastritis or eosinophilic colitis, you need to be eliminating that particular food for 8 to 12 weeks. So first thing first, as we discussed, rule out medical causes. So just don't start off things. First, rule out medical causes because the protocols change. So as I said, eliminate the suspected food for first 2 weeks if your child is not diagnosed with medical conditions. But if your child is diagnosed with medical conditions, you need to eliminate it for 8 to 12 weeks, which means almost 2 to 3 months. Okay. And first, what kind of food you need to be eliminating is all those food which has come positive in the allergic tests. And most of the time, if all the tests, let's say, are negative, the primary food which you need to eliminate based on different papers and books which I've read and what knowledge I acquired through discussing with my colleagues and all, what conclusion they come is the things which you need to avoid is milk, wheat, soy, peanuts, fish, shellfish. These are the certain certain foods which most of the children are found to be allergic. So if all the tests, after you do the test and child is not found to be allergic, and if you still want to try on certain elimination and challenging diets for your kid, start off eliminating these things first. And then comes challenge your child back with these eliminated foods. So first you're eliminating it, and then you're challenging your child with this eliminated food again, which means you're reintroducing the food for 1 week back. And you have to watch the symptoms closely to see whether they are reoccurring. And if you have eliminated more than, let's say, if you have eliminated more than 1 or 2 food or 3 foods, 3 different kinds of food, you should not be introducing all of them at a time. You should be introducing 1 food per week. 1 food a week is what you need to be reintroducing it. Okay, so I hope this is clear. First, you need to eliminate. If there is no medical condition, you are eliminating that food for 2 weeks. If there is a medical condition associated, you are eliminating that food for 8 to 12 weeks. Now, let us see how do you really go about treating these particular things. Treating this food allergies or food sensitivities or food intolerances. Now, first thing first, you have to heal your gastrointestinal tract. So to heal the gastrointestinal tract, there are 3 different ways or 4 different ways which are involved. Now, number 1, the step 1 is to make appropriate dietary modifications. Before you change anything, you need to first think about the appropriate modification what you're giving. And most of the time, this modified diet will contain most of the fiber and water, right? So introduce fiber and water. That is one of the way to treat your gastrointestinal tract. And the step 2 of treating or healing your gastrointestinal tract is try with the basic supplements, which most of the parents use, right? The probiotics, the antifungals, and the different digestive enzymes. Now, what happens when you take a probiotic? Most of them use this, like, my child is on a probiotic, child is on omega-3, child is on this. But please understand, why do you actually use probiotic? Probiotic is used to enhance the immune system of the child. It decreases the frequency of their diarrhea or constipation, and it creates better formed stools. And there is an evidence that by giving probiotics, it heals the skin conditions like eczema and any kind of dermatitis related concerns, and it increases the integrity of your gut barrier, the barrier which we have been talking about, of this nutrients going from your intestine into the bloodstream. So it increases that integrity of it and does not allow that excessive permeability for the larger molecules to transfer through. And antifungals are most of the time are used because I'll talk about it more when we talk about antifungal diet. But as we know that antifungals most is something related to yeast, right? And it is usually available in herbs and garlic extracts and grapefruit seed extracts, certain things. And digestive enzymes, many times, most of the kids are being kept on different kind of digestive enzymes, but please look in for protease, lipase, amylase, lactase, and sucrose. These are the 5 essential enzymes which need to be there and which usually children with autism are found to be deficient with. As I'll repeat, protease, lipase, amylase, lactase, and sucrose are the 5 enzymes which needs to be there in your digestive enzymes when you are providing them with basic supplements. And step 3 is consider trying advanced supplements. Advanced supplements like omega-3 and glutamine. These two are the major advanced supplements which are provided to the child, but there is a specific duration for that. And that is the reason why we keep telling parents to recheck every 3 months, and if it is again found to be deficient, that's the time you can continue. But these are certain things which can be used only for a limited period of time, not a continuous effort. And glutamine, as all of you know, probably most of you might be knowing about it, like it is available in chicken, beef, fish, eggs, and if you are a vegetarian, then probably in cabbage, spinach, and parsley. And step 4 is the major thing. You need to identify and eliminate problematic foods in your kids. So to treat your gastrointestinal tract, there are 4 steps. Number 1, make appropriate dietary modification. Number 2, try basic supplements like probiotics, like digestive enzymes, and antifungals. Number 3, consider trying advanced supplements like omega-3 and glutamine. Number 4, identify and eliminate problematic foods. These are the 4 steps which are involved precisely in treating the gastrointestinal tract. So, first thing first, rule out the medical causes, address it with the appropriate physician who needs to deal with that. Number 2, if your child is found to be having food allergies, food intolerance, and food sensitivities, these are the things which help to treat the gastrointestinal tract. The 4 steps which I told, they help in treating the gastrointestinal tract. And now let us see what GFCF diet means, or what specific carbohydrate diet means, what is antifungal diet or Feingold diet or Nemetschek protocol. So these are the different diets most of the time most of the parents keep using it. Rotational diet, there are different kinds of diets which have come into existence, right? And the most very popular term in the autistic community is GFCF, and nowadays it has spread to Down syndrome also, because Down's children are found to be having secondary comorbidity with autism. So most of the parents on Downs are also keeping a child on these elimination diets. But what you need to really understand here is, whenever you are eliminating a particular diet, you need to understand that you are not giving your child other important vitamins or minerals or nutrients which their body requires. For example, if you avoid milk, if you avoid casein or casein related products, what you need to understand is you're not providing your child with calcium, which is a major which helps in binding major neurotransmission in the brain of a kid. So calcium is not going, vitamin B6 is not going, vitamin B12 is not going, which are the major components, right? Which are the major components for the overall cognitive growth or the overall growth of the child. So that is the reason why I told first step is make appropriate dietary modification. If you're putting your child on elimination diet, first you need to make it up. Which is not so simple, which cannot be done through Google, or which cannot be dealt by different parents group, or which cannot be dealt by you cannot get that information unless and until you don't sit with a qualified nutritionist who can tell you that if you miss this, these are the alternates what you can give to your kid, so that he does not miss out on all those things which they require, right? And we all know that, as I said, whether to give or not to give, whether it is helpful or not helpful, there is no clear-cut scientific evidence-based research yet on this. So that's the thing which I told. I will not support nor I will refute it. So what is GFCF DAT? See, what happens is when you take gluten and casein, there are two proteins which are released. One is gliadomorphin, which comes out of your gluten. And when you talk about casein, it is casomorphin. And these two protein peptides are considered as opiate products. And opiate products are nothing but they have an depressing act on your central nervous system and precipitates the symptoms of autism. So that is the reason why they say to avoid gluten and casein, because it has got these two protein peptides like gliadomorphin and casomorphin, which are similar to opiates, and opiates are there in the brain. So when you're taking this and when your digestive enzymes are not breaking down these products, or if it through the leaky gut, if they go through the bloodstream and not getting extracted, what happens is they cross this blood brain barrier and get attached with this opiate opiates in your brain, and they get binded there. And that's the reason why the functionality of the brain, because it's depressing already the central nervous system, the functionality of the brain will not be to the level where it should be. So this is the opiate excess theory behind gluten-free and casein-free diet, which was introduced by a general medicine doctor by name Reichler in 1980. So when he has done these urine tests for children with autism, he has found these two protein peptides which have been really excessive in them, and that's the reason why he has come up with this theory, opiate excess theory, to put a child on gluten-free and casein-free diet. And the next theory which supports gluten-free, casein-free diet is your non-IgE mediated allergens. There is again the theory which says children with autism are already predisposed to these allergic reactions. When you give them this diet, they're predisposed to these allergic reactions for dietary protein. The theory is that they are already allergic to the dietary protein, and when you give this protein again to them, it can lead to gastrointestinal inflammation and behavioral problems. So these are the two theories behind which the gluten-free and casein-free diet is being introduced for children with autism. So whatever the reactions which I've told, they do take place, but once you keep a child on that diet, there is no evidence that how much of impact or how much of results or how much is it helping a child with autistic symptoms or autistic presentation. Now, there are 5 different steps involved whenever you are keeping a child on gluten-free and casein-free diet. First, expose child to gluten casein-free diet in a gradual and non-threatening manner. Expose it in a gradual and non-threatening manner. And second, eliminate the obvious sources of gluten and casein, and eliminate hidden sources of gluten too. See, hidden sources of gluten is very important. Most of the parents just stick on to avoiding the original sources of gluten and casein, but most of them really don't do a research on what are these hidden sources of gluten. Gluten is precisely present in many of the medications, and many, like Play-Doh. Your Play-Doh has got good amount of gluten. Children play with that and they start keeping their fingers in the mouth. So you are providing gluten even if you are putting your child on gluten-free diet. So eliminate hidden sources and try to know what are the hidden sources of gluten, and educate your family members, educate your friends, and educate the teachers, because what happens is usually children crave for carbohydrates, right? So you might be putting them on gluten and casein-free diet, but when you go out to a different home or your friend's house, they suddenly find something and they grab it and eat it off. But what you need to remember is once they take it, whatever exercise what you have done for the past few weeks is already gone, number one, and number two, you need to wait for that to get eliminated also. So educate the people around you when you're putting your child on it, and assess whether your child is a positive responder or is not at all responding. So these are the 5 steps involved if you are keeping your child on a gluten-free and casein-free diet. So that is about gluten-free and casein-free for you. And there is another diet which we need to talk about is specific carbohydrate diet, right? This is coming up nowadays pretty much into existence, and many of the parents are working on putting their child on specific carbohydrate diets too. See, what you need to understand here is that when the carbohydrates, when they are broken down, they are broken down into single sugar units, double sugar units, or polysugar units. And what they say is the single sugar units are easy to digest in comparison to the disaccharides or the polysaccharides, which means 2 sugar units or more than 2 sugar units. Okay, and what it does is, once you take this, it will inhibit the absorption of nutrients, especially your vitamin B12, thereby causing many of these behavioral problems. If vitamin B12 is found to be deficient, it is associated with many of the cognitive development or the behavioral concerns in children. So this specific carbohydrate diet is precisely limiting disaccharides and polysaccharides in your children and encouraging them to take more of single sugar unit carbohydrates. And single sugar unit carbohydrates are nothing but your glucose, fructose, and galactose. Your double unit sugars, which you need to avoid, which you need to limit or eliminate in your child's diet, is sucrose, lactose, and malactose, and polysaccharides as in starch. So those are the things which they do in specific carbohydrate diet. The theory behind putting a child on a specific carbohydrate diet. And when you talk about antifungal diet, it is nothing but yeast-free diet. See, there is a yeast called as Candida albicans. Which is research has been proved that this particular fungus is the main reason for the leaky gut syndrome in children with autism. And it will increase the permeability of the gastrointestinal wall, thereby causing all that what we have spoken. So the antifungal diet is nothing but yeast-free diet, where this antifungal diet is never given alone. It always goes with conjunction of probiotics, medications, and antifungal diet together. It goes as a combination, so that that creates a balance, that creates a flora balance inside the gastrointestinal tract. So that is the theory behind your antifungal diet. As I said, the yeast Candida albicans. This yeast is found to be a reason for the leaky gut. And another one, Feingold diet, which most of the parents again keep their children on that. Feingold diet is nothing but, there is a product called as salicylates. Salicylates. There is a product called as salicylates. This is the product which is available in most of the food which we get outside, whether it is natural or whether it is preserved or in containers or whatever it is. The salicylates are present in many of the food stuff which we take, and this triggers the symptoms. Simply to put, it has got 2 steps. Step 1, the artificial colors, flavors, preservatives, aspirin, and food containing salicylates is eliminated. And the major source of this salicylates is your almonds, apples, berries, cherries, clove, coffee, tea, oranges, grapes. There is a huge list of natural food which contains salicylates. So first what they do is they eliminate this. They eliminate artificial colors, flavors, preservatives, and the food containing the salicylates. And they do it for 4 to 6 weeks. You need to eliminate that for 4 to 6 weeks. And once you see that there is an improvement or a change in your child's behavior, then the step 2 is initiated, where you're adding back food that contains salicylates one at a time to determine which food is actually causing an adverse reaction for your child. So this is about that Feingold diet for you. And rotational diet is another one thing which is coming up newly into it, where you don't give the same food day after day. Like if you give a food today, you are going to give that food after 4 days for your child, and people have found to be certain changes doing that too. Okay. And how do you know whether your child is a positive responder or whether your child is non-responding to it? First, implement these elimination diets, conduct it for 2 to 3 months, and maintain a document of symptoms prior to starting and at the end of elimination phase. And then challenge your child back with those foods which you have stopped. And if you are really talking about gluten-free, casein-free, introduce soy first, then casein, then gluten. And see if the symptoms are reoccurring, then that means that your child is a positive responder if he is on gluten-free and casein-free. So if your child, if the behaviors are not reoccurring, then you can continue that particular diet for your kid. Okay, so those are the steps involved. And another one major important important therapy which I have come across of late is megavitamin therapy, where a child is being kept on a high dose of vitamin B6 and magnesium together. The reason why magnesium is being kept, because magnesium is one of the major component which actually binds and which actually breaks down, helps in breaking down thousands of nutrients. So B6, vitamin B6, the reason why they increase the doses of vitamin B6 is because it is a high source which helps in synthesis of serotonin and dopamine, which are the two key neurotransmitters which play an important role. They play an important role in modulation of mood, anger, aggression, sleep, and appetite. So that's the reason why they increase the dosages of vitamin B6 and magnesium to the kids, and it is called as megavitamin therapy or megavitamin diet therapy for kids, because low levels of serotonin are found to be related with depression, anxiety, aggression, and certain obsessive compulsive behaviors in our kids is found to be because of low levels of serotonin. And whereas dopamine, we all know that it helps in our mood, sleep, and motor activity and behaviors, right? And cognitive functions like attention, memory, your concentration, your learning, your problem solving are all associated with the release of the dopamine or synthesis of dopamine. And many of the children are found to be vitamin B6 deficient or serotonin or dopamine deficiency, especially children with autism. So, but how much to give? How much to give is the biggest question, which is not answered yet. What is the dosage? What I mean, how much you need to give? What is the dosage which you need to give? The dosage which you need to give is not yet determined through research, but Autism Research Institute says that, you need to be, you can provide vitamin B6 anywhere between 200 to 500 to 1000 mg basing on the weight of the child. So if your child is 1 pound, that means you are giving him 8 grams of vitamin, 8 grams of vitamin B6. So that's how you calculate. If your child is 1 pound, so you are providing them 8 grams. And this is not something which I'm saying. This is something which is the guidelines of using this vitamin B6 according to Autism Research Institute. What you need to remember is whenever you are putting your child on this vitamin B6, you are not immediately giving them, let's say your child requires 200 grams a day. So you're not immediately putting your child on 200 grams at once, but what you are doing is you will start off with a quarter of it. Which means 50 grams is what you start, and within 2 weeks, within 14 days, they say that you need to be reaching the full optimal optimal dosage. So that is how you calculate vitamin B6. And magnesium, as far as magnesium is concerned, it is per pound 3 to 4 milligrams per pound body pound weight of 1 pound weight of your child, it needs to be 3 to 4 milligrams. And another one, chelation therapy, which is highly controversial, where they use drugs through the intravenous, and the drugs like EDTA, DMSA, and DMPS. These are the three usual drugs which are used, which helps to eliminate toxins through urine and stool, is what the theory behind that is. But it is highly controversial treatment because it can lead to mineral depletion in child, and it can rupture the blood cells of child and liver damage, and it can suppress the bone marrow. And there are certain, if these dosages are not being properly administered, if the dosages are not being properly administered, there are certain children who have there are certain case studies which have reported that kids dying because of chelation therapy too. So these are certain things which you need to remember, and what you need to understand here is the reason why. See, every autistic child is found to be having certain sensory concerns, sensory issues, right? And if it gets associated with these allergic symptoms, like, itchy skin, eczema, runny nose, or whatever symptoms which we have spoken about, what it causes is that the combination of these sensory issues and these food allergies can hinder child's ability to sit still, their ability to concentrate, their ability to maintain focus and the process the information the way it should be, and their ability to learn or ability to control their impulses and behaviors is affected in them. So what it is important to know that most of the children on autism are or not at verbal, or they might be having delayed speech, right? And that adds on to their problems, because all these problems like nausea, abdominal cramps, or the chest pain due to the reflex, and all the irritability or the skin allergies, or the running nose, all these symptoms which they cannot express or which they cannot be kept, this physical pain which cannot be verbalized, is transformed into behavioral problems of tantrums, or head banging, or pinching, or irritability, or refusal to eat. So it is important for you as parent, because often these behaviors are considered as autistic symptoms, but these behaviors cannot be autistic symptoms. They could be because of the food allergies or the sensory issues what we have spoken. So what you need to understand through this particular topic, what we have taken in last two webinars, is first rule out the medical related conditions in your kid, including the dental problems, then rule out food allergies, food intolerance, and then food sensitivities. Then work on your elimination and challenging diets, as we have spoken about different diets, and or by putting them on multivitamin therapy. And then comes the role of reflex integration. So these first two steps need to be finished, need to be done prior actually determining whether your child is a problem eater or a picky eater. So these two play a vital role. The food allergies and the medical conditions and food allergies play a vital role, which might make you feel that your child is a picky eater or a problem feeder. But the reasons for them to present it in that particular fashion could be these reasons, which have to be looked into prior thinking or prior acting on your kid, or implementing any neurodevelopmental or any therapeutical interventions, or your feeding therapy, or your oral placement therapy, or your sensory integration therapy, or reflex integration therapy, before getting them into picture. These are the first things which you need to rule out. And in our institutes, it's a protocol to rule out. It's a protocol to see what are the carnitine levels, see whether the propionic acids are good, see whether how is the amino acid panel in the child. We maintain that protocol. We get a child to go through all that before we actually intervene with the child with any therapeutical intervention. And when it comes to the therapeutical intervention, as discussed last time, it is about first try to understand the oral dysfunctions of your child, hypotonia and other related concerns. Then the reflexes, we have discussed about the 6 or 7 reflexes which play a vital role. Then the sensory integration process, because as eating is considered to be one of the highest functionality where all the senses are included. And after the sensory integration protocol, then we've spoken about chaining method, and then we've spoken about SOS therapy, like sequential oral sensory therapy, wherein we spoke about 32 different steps, how it is involved and how to introduce each and everything. So I hope I have given you enough information pertaining to the picky eating and problem feeding. So as mentioned, it is not so simple to just sit over there and just make a statement to say that my child is a picky eater or my child is a problem feeder. There are so many different reasons behind why your child could be a picky eater or a problem feeder, or why many of the behavioral concerns are not getting resolved in your children. So I hope to my best knowledge, and as far as whatever the research says, I have given what knowledge I have. So probably basing on whatever I have spoken, approach the right therapists or the right physicians if you have any doubts, or if you see whatever we have spoken is existing in your kids. So Saujanya, I think I covered maximum to my knowledge on this topic. So
Thank
I'm
you,
happy to
sir.
take.
Thank you so much. It's really very valuable information. And I would like to thank all the parents who joined in today. I know with how much of dedication Samraj sir wanted to bring this topic to all the parents and all the children. So thank you, sir. Would you like to take any questions?
Sure, ma'am.
Yes, parents, please. If anyone has a question, please be specific. Please go ahead.
Yeah, thank you, sir. My name is Srinivas. It's like to find out like what are the food allergies kid is having, or so like what diets we have to follow. So for this process, to whom we have to consult, sir?
Well,
Like,
the first step is that you need to catch up with your gastroenterologist, gastrointestine specialist, or any metabolic disorder specialists. That is the first step which you need to rule out whether any medical conditions are there. Okay, if medical conditions are there, then it is very direct to understand what foods your child is allergic to, and you can straight away eliminate them. Okay, so that is the first step which you need to do. And once you once your results come, or once your blood workup is done along with your physician, then it is a role of your nutritionist who needs to sit along with you to determine uh, what are the foods which you need to be eliminating, and what are the foods which you need to supplement on those foods which you are eliminating, and whatever the kid is missing out on those foods, whatever the micro and macronutrients your child is missing out, by eliminating that food, they need to provide you with an alternate substitute food. So the second step is the nutritionist. So first is your gastroenterologist or a metabolic disorder specialist. Second step is about your nutritionist, or most of the people approach a dietitian. Dietitian does not play a role in that. Please understand that it is more to do with a nutritionist. So the second step is your nutritionist, and then probably once you maintain that chart, it is the third person is a parent to know how effective it is or not.
yeah, thanks a lot, sir.
Yeah.
Supriya, you have a question?
Yeah, ma'am. So, sir, I missed out on attending the first session. Sorry, so I'm coming in with partial context. Maybe you might have covered this earlier. So, like, I have heard about these specific diets earlier from other people as well, but my concern always has been like, how sustainable is it? Like, even as you said that for gluten-free or casein-free diet, I mean, suppose we are keeping the child on a gluten-free, casein-free diet, and a particular instance happens where the child is exposed to it, and then those elements come in back in the body, and until that has been flushed out, we don't go back to where we were. So on a long term, how sustainable is it if any instance of not following it kind of disrupts the entire cycle?
Yeah, that's a major challenge. There is a major challenge in keeping child on any specific diet. Because we won't be in a situation like, let's say a child goes to a school and you probably would have prepared his own gluten-free, casein-free diet, but he sees some other box and he just picks up and eats. Or in the school, without knowing, as a reinforcer, they might give a candy to your kid or the stuff which he should not be taken. So that's the reason why making it aware to the people in your environment is very, very important. And everybody in the home, or if whenever you're taking your child out, you need to be very specific about either you need to take your child tummy fully, or you need to be taking them to the place where it is not available. So that's the reason why educating the friends, family, and school is very important when you're keeping your child on a specific diet. But as said, see, uh, it is an exercise. It is an exercise for 2 to 3 months for you to really understand whether it is actually your child is positively responding to it or he is not responding to it. So once you do this exercise for 2 to 3 months, you will, and once you start reintroducing, you will really able to understand. So most of the parents bluntly keep their children or 100%, 100% at one shot, they will put their kids on a complete elimination diet, which is very wrong. Very wrong.
Okay. Yeah, because on one hand, like with my child specifically, we are struggling that she's very, very, very picky. She would not want to try new things. On the other hand, if we start eliminating things which she's already eating, then we are left with very restricted list.
100% true. See, as I said, like probably as you said, you missed out on the last topic where we have covered a lot of medical conditions which can make them become a picky eater. So unless and until actually you don't rule out those medical conditions, that I will definitely not suggest any of the parent to keep their child on a specific diet.
Okay, yeah. And so just one more thing, like, so as you said, like we have to try whether the child is showing any positive response to it or not. And suppose the child is showing a positive response to a gluten-free, casein-free diet, we continue for 2-3 years, and the, along with other reinforcing therapies also running parallelly, the child gains skills, is learning new skills. What happens when we introduce or come back to a normal diet? Would the child would I would expect the child doesn't lose their skills. It's just that their cognitive regulation, those things start coming down.
See, that's the major reason why there is no scientific evidence yet.
Okay.
Because how far it is really helping children with autism is big debatable thing. Certain doctors will say that immediately, as soon as nowadays, I think I find it on every prescription which a doctor writes when a child has been diagnosed with autism. Straight up gluten-free, casein-free diet is what is been prescribed, which is a very wrong methodology, very wrong practice, which is a very wrong practice. Because as said, see, nutrition is something which plays a very vital role for the overall growth of the child, right? Whether it is normal kid or whether it is a child with autism, nutrients are the ones which help in general physical growth and cognitive growth of the kids. And without really understanding or without really knowing whether you can actually keep them or not, without really knowing whether the child is having any medical related concerns or not, if you're straight away putting your child on this kind of diets, is 100% not suggestible. You need to be very particular before you actually start them on this kind of diets.
Okay, all right, yeah. Thank you, sir.
You're welcome.
So I think we are done with the questions, sir. Maybe sometime in the future we'll take few more questions, or in a a question based webinar. So what we essentially want to focus here is, just because there are some WhatsApp groups supporting this GFCF diet, or generally some friend, another parent suggests this, please don't straight away start with this particular diet or any other protocol. There is so much of scientific data and so much of medical information that Samraj sir explained to many parents here today. So the effort is to basically observe your child and try to take the right approach. So I believe these two webinars are very helpful to many parents here, and in the coming days I'll try to upload it on YouTube as well. And I hope this effort will be helpful to many kids. Sir, thank you so much. I appreciate your coordination with me and helping many parents here on Mitra platform. Thank you, sir.
Yeah, you're welcome, ma'am. All of you have a good day. Thank you so much.
Yeah. Thank you all. See
Yes,
you.
sir.
Thank you. Thank you.
Thank you. Thank you.
Thank you.
Thank you so much.